I'm Dr. Howard Kaufman. I am a general and colon and rectal surgeon practicing in Pasadena and Glendale, California. I'd like to start this discussion by talking about what hemorrhoids really are. And a lot of people are told by their doctors or their friends that they have hemorrhoids if they have any anorectal complaints, and that's just not true. So let's talk about hemorrhoids in health and then hemorrhoids in disease. Hemorrhoids are actually healthy in normal life. They help us discriminate between solids, liquids, and gas, and they help us with maintaining continence so that we can get to an appropriate place at an appropriate time to have a bowel movement without any leakage before then. It's when hemorrhoids get larger and get full of more blood flow that they start to cause problems. Now, the normal hemorrhoidal tissue occurs in 3 places in the lower rectum and the anal canal. 1 on the left side, 2 on the right side. When hemorrhoids start to get larger, and those are caused by several things, they can start to leave the body, not permanently, but temporarily. They swell and they slide down. They can come back up, which is an earlier stage of hemorrhoids, or they can stay outside of the body and need to be pushed back up by the patient. In the worst cases, they're always outside of the body and neither the patient nor their doctor can push them back up. Hemorrhoids have blood vessels that lead to them, and they also contain fibrous tissue and muscular tissue. So when the blood flow increases to hemorrhoids, they actually get more swollen, and they start to push away from the lining of the lower part of the rectum. We all know that as we age, skin gets more lax. It occurs on our face, it occurs on our arms, it occurs on our abdomen. It's no different in the lower part of the anal canal. So with increased blood flow and with the normal changes that happen with aging, this tissue can loosen up and start to slide outside of the body. Let's talk about the grade of hemorrhoids. And when we talk about grade or stage or degree of hemorrhoids, it's all related to what are called internal hemorrhoids. When hemorrhoids remain in the internal part of the body, that is in the lower rectum or the upper anal canal, and they just swell due to this increased blood flow, they're considered first-degree hemorrhoids. Those types of hemorrhoids can cause symptoms like bleeding or itching, but they don't fall outside of the body. They don't prolapse outside of the body. Grade 2 or second-degree hemorrhoids swell up and they start to slide down outside of the anal canal, but they go back up on their own. This usually happens not when someone's walking around or not when someone's sitting or driving, but when we're straining to have a bowel movement. Third-degree hemorrhoids are even more advanced. Those occur when the hemorrhoids come out and they don't go back up on their own. The patient has to push them back up, and they usually stay back up and again rarely come out except during bowel movements. And at the most advanced stage of hemorrhoids, that is 4th-degree hemorrhoids, the hemorrhoids stay out of the body and they don't go back in. And not only can't a patient push them back in, but their doctors can't push them back in. What we've been talking about is internal hemorrhoids, and that's very different from external hemorrhoids. External hemorrhoids are just areas of skin in the lower part of the anus that are always there. They never go back in. Those types of hemorrhoids are always there. They can develop clots in them, they become more painful, and they often require somewhat more urgent medical attention.